Good evening, guys. I've got your C for you. We're discussing geoscience and the way they think, or they're rethinking how medicine can approach aging based on preliminary on the surroundings pages content from the tab you have open. What the headline signals is signaling. The page frames geoscience as a paradigm shift in medicine. Instead of focusing narrowly on treating diseases once they appear, geoscience emphasizes that targeting the biological processes of aging itself. Aging is presented not just as a backdrop to disease, but as the primary driver of most chronic conditions. By intervening at the root level, medicine could potentially delay or prevent multiple illnesses at once. What the surrounding page content explains. The article describes geoscience as an interdisciplinary field that blends biology, medicine, and public health to understand why we age biologically and how those processes can be modified. It contrasts this with the traditional one disease, one specialist model, which often leaves older adults juggling multiple treatments without addressing the underlying cause. Aging biology drives disease clusters. The content highlights that diseases such as heart disease, cancer, diabetes, kidney failure, and dementia share common biological mechanisms. Chronic inflammation that damages tissue over time. Cellular senescence, where zombie cells stop dividing but continue to release harmful signals. Metabolic decline and mitochondrial dysfunction. Epigenetic changes that alter gene expression with age. By targeting these processes, medicine could reduce the onset of many conditions simultaneously rather than fighting them piecemeal to biological age versus chronological age. The page notes that health systems are beginning to test biological age measured through biomarkers as a more accurate predictor of outcomes than calendar age. For example, biological age may forecast hospitalization risk or treatment response more effectively, opening the door to personalized preventative care. Repurposing existing drugs. The article points to medications already in use that may influence aging pathways. Metformin, a diabetes drug, is being studied for its effects on inflammation and longevity. GLP-1, like semaglutide, used for diabetes and obesity, mimic calorie restriction, a known mechanism for extending lifespan. Uh, Senol- Senolix, Senolix experimental drugs designed to clear senescent cells could reduce tissue damage and inflammation. These examples show that geoscience is not uh, uh, speculative. It is entering clinical trials and practice, extending health span. The surrounding content stresses that the goal is not simply adding years to life, but adding healthy years. Geoscience aims to reduce disability, multimorbidity, and frailty, ensuring that longevity comes with vitality and independence. The core message of the page. The article argues that medicine must rethink its approach to aging instead of waiting for age related diseases to appear and threatening or treating them separately. Clinicians and researchers should intervene earlier by modifying the underlying biology of aging. This is presented as a transformative shift, one that could improve quality of life for older adults, reduce healthcare costs by preventing multiple diseases at once, help help societies adapt to rapidly aging populations. Why this matters beyond medicine. The surrounding content also implies broader implications. Healthcare systems, a geoscience approach could ease the burden of hospitals and long-term care facilities. Policy. It reframes aging as a modifiable risk factor, not an inevitable decline, which could influence insurance, Medicare, and public health strategies. Equity. By focusing on prevention, geoscience could reduce disparities in aging outcomes across different communities. If you'd like, I can adapt this into a podcast segment outlining the outline for the issue with living longer. A community explainer that makes geoscience accessible to caregivers and seniors, or a culturally responsive toolkit that translates these ideas into actionable strategies for diverse populations. Okay, guys, so that is your C for tonight. Um, I will jump back on later on for D. For now, Gator Wellness. Take care, folks.